Choking is a scary thought for any parent. It can happen quickly and quietly. Thankfully, there are many things we can do to prevent choking in children. By knowing the risks and what to do in an emergency, we can keep our little ones safe. This guide will give you practical information on choking hazards, safe eating habits, and first aid. Remember, even with the best precautions, accidents can still happen. Knowing how to respond can make all the difference. Let's learn how to protect our children and give them the safest start in life. Together, we can create a safe and happy environment for our little ones to thrive. Children are naturally curious and love to explore the world by putting things in their mouths. This is why it's crucial to be aware of common choking hazards. Foods pose a significant risk, especially for young children. Hard, round objects are the most dangerous. These can easily get lodged in a child's airway. Some of the most common choking hazards for children include hard candies, grapes, nuts and seeds, small round fruits like cherries and blueberries, hot dogs and sausages, chunks of meat or cheese, popcorn, small toys, coins, buttons, and pen caps. Be mindful of these items and keep them out of reach of young children. Regularly check under furniture and between cushions for small objects. Establishing safe eating habits early on is crucial for preventing choking. It's not just about the immediate safety, but also about instilling lifelong habits that promote health and well-being. By teaching children these habits, we can help them develop a safe and enjoyable relationship with food. This means they will be more likely to make healthier choices as they grow older, understanding the importance of eating mindfully and safely. Always supervise mealtimes, especially for young children. Supervision ensures that any potential choking hazards can be quickly addressed, and it also provides an opportunity to reinforce good eating habits. Encourage them to sit down while eating and avoid running or playing with food in their mouths. Sitting down helps them focus on their food, reducing the risk of choking and promoting better digestion. Teach children to take small bites and chew their food thoroughly before swallowing. This not only helps prevent choking but also aids in proper digestion and nutrient absorption. This is especially important for foods that are hard, sticky, or slippery. These types of foods can easily become lodged in a child's throat if not chewed properly. Cut food into small, manageable pieces, especially for young children. This makes it easier for them to chew and swallow safely, reducing the risk of choking. Avoid giving young children hard candies, grapes, and nuts. These foods are common choking hazards and should be kept out of reach of young children. By following these simple rules, we can significantly reduce the risk of choking and create a safer eating environment for our children. It's about creating a foundation of safety and mindfulness that will benefit them throughout their lives. Additionally, discussing food safety openly with children helps them understand the reasons behind these rules. When children know why they need to follow certain guidelines, they are more likely to adhere to them. Demonstrating safe eating practices can be a fun and engaging activity. Use mealtime as an opportunity to teach children about different food textures and how to handle them safely. Encourage children to try a variety of foods while maintaining safety. This not only broadens their palate but also teaches them how to handle different types of food safely. Praise and positive reinforcement go a long way in encouraging safe eating habits. Celebrate their efforts and make mealtime a positive experience. Remember, the goal is to create a safe and enjoyable eating environment for our children. By instilling these habits early on, we set them up for a lifetime of healthy and safe eating practices. Introducing solid foods is an exciting milestone, but it's crucial to do so safely. Babies are still developing their chewing and swallowing skills, making them more susceptible to choking. Start with smooth, pureed foods and gradually introduce foods with more texture as your baby grows. Avoid giving babies foods that are hard, sticky, or easily break into small pieces. Never leave your baby unattended while eating. Always supervise them closely and be prepared to intervene if they start to choke. Remember, every baby develops at their own pace. If you have any concerns about your baby's feeding development, consult your pediatrician or a registered dietitian for guidance. Section 5. Choking. First aid for infants under 1. Choking is a serious emergency that requires immediate attention, especially in infants under 1 year old. Knowing what to do if your baby chokes can be life-saving. It's crucial for parents, caregivers, and anyone who spends time with infants to be prepared and knowledgeable about the steps to take in such a situation. If your baby is choking, they may be unable to cry or make any noise. This is because the airway is blocked, preventing air from passing through. You might notice that your baby is struggling to breathe, their face may turn red or blue, and they could be coughing weakly or not at all. First, check their mouth for any visible obstructions. Look inside their mouth to see if there is an object that you can easily remove. Be very careful not to push the object further into the throat. If you can see something, try to remove it carefully with your fingers. Use a gentle sweeping motion to clear the object, but only if you can see it clearly, and it is easy to reach. If your baby is still choking, lay them face down along your forearm, supporting their head and jaw. Make sure their head is lower than their chest to use gravity to help dislodge the object. Give up to 5 sharp blows between their shoulder blades with the heel of your hand. These back blows create pressure and vibrations that can help to dislodge the object from the airway. If the object doesn't come out, turn your baby over and give up to 5 chest thrusts. This involves placing the baby on their back and using 2 fingers to apply pressure to the chest. Place 2 fingers in the center of their chest just below the nipple line and push sharply inwards and upwards. This motion helps to create pressure in the chest, which can force the object out of the airway. If your baby becomes unresponsive, call for emergency medical help immediately and begin CPR. It's important to keep calm and act quickly. Start with 30 chest compressions followed by 2 rescue breaths, and continue this cycle until help arrives or the baby starts breathing again. Practicing these techniques regularly can help you stay prepared. Consider taking a certified infant first aid and CPR course to build your confidence and skills. There are many resources available to help you learn more about infant first aid. Books, online courses, and community classes can provide valuable information and hands-on practice. Additionally, there are apps and digital resources that can guide you through the steps of infant first aid in real time. These tools can be incredibly useful in an emergency situation. After the choking incident, it's important to comfort your baby and monitor them closely. Even if the object has been removed, there could be lingering effects or injuries that need medical attention. Always follow up with your pediatrician after a choking incident. They can check for any complications and provide further guidance on how to prevent future incidents. Prevention is key. Baby-proof your home by keeping small objects out of reach, cutting food into small manageable pieces, and supervising your baby during meals and playtime. Join a community of parents and caregivers who are committed to safety. Attend workshops, share experiences, and support each other in learning and practicing first aid. By being prepared and knowledgeable, you can feel more confident and empowered to handle emergencies. Remember, your quick and calm response can make all the difference in saving your baby's life. Stay informed, stay prepared, and keep your baby safe. Thank you for watching this guide on first aid for infants under 1. Section 6. Choking child over 1. What to do. If your child is over 1 year old and choking, the first thing you should do is encourage them to cough. Coughing is the body's natural defense mechanism to clear the airway. It is important to stay calm and reassure your child, as panic can make the situation worse. Coughing is the body's natural way of clearing the airway. It helps to expel any foreign object that might be blocking the throat. Encourage your child to keep coughing, as this might be enough to dislodge the object. However, if your child is unable to cough, speak, or breathe, it is crucial to act quickly and perform the Heimlich maneuver. This technique can be life-saving and is essential knowledge for any parent or caregiver. To perform the Heimlich maneuver, stand behind your child and wrap your arms around their waist. Make sure you are in a stable position to provide the necessary support. Make a fist with one hand and place it just above their navel. This is the optimal position to apply pressure and create the force needed to expel the object. Grasp your fist with your other hand and give a series of 5 quick upward thrusts. These thrusts should be firm and directed inward and upward, as if you are trying to lift the child off the ground. Repeat the thrusts until the object is dislodged or your child starts to cough or breathe. It is important to monitor your child's condition closely and be prepared to act if the situation changes. If your child becomes unresponsive, call for emergency medical help immediately. While waiting for help to arrive, begin CPR. This involves chest compressions and rescue breaths to maintain circulation and oxygen flow to the brain and vital organs. Continue CPR until emergency responders take over or your child starts to breathe on their own. Remember, staying calm and acting quickly can make all the difference in a choking emergency. Always be prepared and know the steps to take to ensure your child's safety. Section 7. When to call for help. Trust your instincts. Knowing when to seek medical help during a choking incident is crucial. If the choking persists or you are unsure of what to do, call for emergency medical help immediately. It's always better to err on the side of caution when it comes to your child's safety. After a choking incident, even if your child seems fine, it's important to seek medical attention. They may have internal injuries that require professional evaluation. Remember, time is of the essence in a choking emergency. Acting quickly and calmly can make a life-saving difference. Section 8. Knowledge is power. Resources for parents. There are many resources available to help parents and caregivers learn more about preventing and managing choking in children. Your local hospital or health center may offer first aid and CPR classes specifically designed for parents and caregivers. Many reputable organizations provide online resources and information on child safety. These resources can provide valuable information on choking hazards, safe eating practices, and first aid techniques. Section 9. You've got this. A final word of encouragement. Preventing and managing choking in children can feel overwhelming, but remember, you've got this. By being informed, prepared, and proactive, we can create a safe environment for our little ones to explore and grow. Keep learning, keep practicing, and never hesitate to ask for help when you need it. Your vigilance and quick thinking can make all the difference in keeping your child safe. Remember, you are your child's first and most important advocate.
Thanks for watching. If you found this video helpful, don't forget to like, share, and subscribe for more content. See you next time.